The Health Minister, Jonathan Coleman, joins us live here in the Auckland studio to discuss the unfolding crisis at the Southern DHB. And in fact, we have an internal document that uses that word, crisis. But first, let's hear again from the patients, their families, the doctors, the specialists, and even welcome, Minister.
Hi, John. How are you?
Yeah, very good, very good.
Well.
Yeah, good. Yeah, good.
Excellent.
Now, just so we're just going to play a track, right? And so we're going to look back over our coverage of the past week or two, and we're going to listen to patients, families, doctors, specialists, and even DHB bosses who all agree to varying degrees that whilst the staff are doing the best job they can, the situation at Dunedin Hospital is untenable, and they need an urgent cash injection from you, the Minister. So I'm delighted to have you here so you can listen to this.
Good to be here.
Yes, so listen to this package. Bridget Burke put it together, and it begins with Bridget Telfer, the daughter of Mosgiel pensioner Merv Telfer, who has had his cardiac surgery cancelled 7 times.
16th of May, he was told it was urgent, and they hoped to have it done in 30 days. And what he was told was that, yes, he definitely needs a heart valve replacement. He definitely needs a double bypass, but once they get in, it could be triple, it could be quadruple, they won't actually know, and that his arteries were 80% blocked.
Okay, so he was told that in May, and since then it's been postponed 7 times, including twice after he was admitted to hospital.
Yep.
68-year-old Owen Glover died last year after his heart surgery was postponed by the Southern DHB. Here's Owen's daughter, Donna.
So they made and cancelled 4 appointments. The 5th one was supposed to be towards the end of August last year. Unfortunately, he died at the end of the first week of August, so he didn't make his so-called confirmed surgery. And like I said, he was 68.
And what did he die of, Donna?
He died of heart related. Basically, his heart just gave up and stopped and just couldn't do it anymore.
And how many times had his appointment been cancelled or delayed or deferred?
4 times.
Nigel Miller is the Chief Medical Officer of the Southern DHB.
We sincerely regret finding ourselves in that position of not being able to meet their reasonable expectations of a surgery taking place. So I absolutely agree with you on that. It's not where we want to be at all. It has been happening more often of late, and I think that's an unsatisfactory situation, I think, as we discussed yesterday. And so we're in a really difficult place. Our clinicians are faced with this really difficult challenge, the difficult problem of, do you select the patient with cancer? Do you select the patient with scoliosis? Do you select the patient with cardiac problems? Each of which is going to suffer some significant disadvantage and potentially some harm if you don't do it straight away.
Paul Schofield paid for his own biopsy for prostate cancer in February. He's been waiting ever since for surgery that ministry guidelines say should have been done within 31 days.
The minister, who's refusing to take calls from Checkpoint, is a coward. This situation is it's just unacceptable. It's obviously a failure in the system. And, whatever happened to ministerial responsibility? It's just one other thing I'd like to say. You've got a perfectly good private hospital there that's got the facilities and the gear to do it. So this is purely and simply money. It is nothing more than that. They have saved $11.5 million of their deficit by cutting back and putting people's lives at risk. I wonder what a coroner would have to say about that man that died because he was unable to get his heart surgery. And I certainly don't want to be in that category because of the incompetence of a group of people. And that's, I'm sure, those other people who are affected just like I am, feel exactly the same. And I know that my family are very angry about this.
Graham Woodside is the Chief Executive of Prostate New Zealand.
Far from satisfactory, John. The faster cancer treatment program stipulates that if somebody's got a confirmed diagnosis, they should be treated within 31 days. Now, that's 1 month, not 5 months.
Dr Daniel Pettigrew is a Dunedin GP.
Basically, I've got 4 patients who are waiting for biopsy, and they've been waiting for between 7 and 14 months.
Do you think it is because of insufficient resources?
Oh, absolutely. I mean, as much as the minister may say, we've got to do more with less, the reality is you can only underfund a health service for so long before that starts translating to the frontline services. And that's exactly where we are now. I mean, we're heading towards a third world health system here.
Kelly Gibbs's severely disabled daughter Amber had her scoliosis spinal operation cancelled as she was being prepped for surgery because of a shortage of ICU beds.
Amber's got a lot of things wrong with her. She's actually got microcephaly, scoliosis, cerebral palsy, epilepsy, developmental delay, and she has asthma. We had her all gowned up, ready to go, and the next minute the surgeon comes into the room and says to us, "We're sorry, but the surgery has to be postponed because a young guy who's had a heart attack has taken Amber's bed in ICU and they're needing a triple bypass."
Chris Fleming is the chief executive of the Southern DHB.
I believe that patients' care has been delayed as a consequence of delaying cases because of lack of ICU capacity. We do not have enough ICU beds, absolutely. I do apologise. The number of cancellations is just not acceptable.
Dr Alistair Hepburn is one of the Southern DHB's 3 urologists who share 2 full-time roles. He says the department is understaffed and this is delaying the treatment of cancer patients.
One of the major problems, yes. It's not the only problem, but it is one of the major problems.
People with prostate cancer?
Correct, yes.
Other forms of cancer?
Definitely, yes.
This is a difficult question for you to answer, and
Sure.
You are in a master-servant relationship with the Southern DHB, even though you are a senior urologist. But do you feel like there are real financial pressures driving what appear on the face of it to be insufficient staff numbers?
I can say that's the feeling I get, yes.
Stephen Mark is chair of the Urology Society.
There is a crisis of patient care because they've got concerns about the inability to deliver the care in the time frames that they wish to do so.
Kathy Grant is the Government Commissioner appointed to the Southern DHB by then Health Minister Tony Ryle in June 2015, after he sacked the board.
If Paul Schofield has now been waiting for over 4 months and has absolutely no idea still when his cancer is going to be treated, is that satisfactory, do you think?
No, it isn't. It isn't satisfactory. The comment that I would make is that Southern has suffered from really years of underinvestment and significant deficits. So the pathway forward is going to take a period of time. There is no
which is look, absolutely, which is all very well and good when we're talking about financial KPIs and deficits and budgets and bringing things in under what the government requires of you. But if you have prostate cancer and you are waiting for treatment and you don't know when it's coming, do you think that you want to even hear those discussions taking place?
Probably not. I acknowledge that the delays are regrettable, that the patient group that you have been talking to do need their surgery. We are making progress. We are investing in the future of Southern DHB and initiating change.
Here's Prime Minister Bill English yesterday.
You need to ask the DHB. I mean, they're responsible for providing services. They've got some targets they are meant to adhere to, which represent good service for the public. And I would hope that if those 10 cases aren't getting the service here, then the DHB makes sure they get it somewhere else.